Health experts have called for a swift response from relevant agencies of government to halt further the spread of measles in Borno State. Reacting to the recent rise in the number of measles cases recorded in the state capital, Maiduguri, they warned that any further delay could endanger the lives of children. Trust TV's Beatrice Kuruti reports.
The Gwange Clinic is one of the health centers where isolated cases are treated. The facility is struggling to contain the outbreak of measles with a record of more than 7,000 cases, despite treating 9,618 patients, mostly children. The facility admits more than 30 patients daily. The medical activity manager, Okoli Jumbo, said mortality rate stood at 1%, which indicates that there is need for urgent intervention, adding that patients, mostly children, experience difficulty in breathing and malnutrition, which is slowing response to treatment.
The case fatality from last year is less than 1%, but it's important to really suppress this transmission, because even though it is the case fatality is, if you look at absolute numbers, it's actually very significant, and we don't want to lose our children that way. At some point, we still expect the numbers based on the trend and the pattern over the years. We still expect the numbers to go up. So at one point, we might become overwhelmed. So based on our speculations, things are still going gradually upward, in upward trend. Now they have taken up the whole ward. The whole unit in the hospital is filled by cases.
Measles is a childhood infection caused by a virus which can be prevented with a vaccine. The disease globally claims over 200,000 lives annually. Some of the patients' parents share their experiences. She started experiencing discomfort around her neck and chest before I took her to the hospital. The mom was not at home because she had gone to Gamboru, although she was not running a temperature. She, however, couldn't lay on the bed. I was very worried for her and could barely wait for a daybreak to take her to the hospital. Yesterday, we were taken to another section of the hospital where she started receiving treatment.
He wasn't feeling too comfortable, so they inserted a tube in his nostrils. After that, he was relieved, but when they removed it, breathing became difficult. Right now, we have spent 3 days in the hospital. Before we came to the hospital, he couldn't breathe normally and he wasn't eating. But now, he eats and breathes well.
Health experts are calling for effective sensitization of the public to curtail the outbreak in vulnerable communities. Beatrice Kuruti, Trust TV News, Maiduguri.